Hey there YouTube, it's Taylor. I am back with a second blog about my lap band surgery. It's been 3 weeks and 1 day since my surgery, and I think it's about time to give y'all an update. So, I have lost 15 pounds since I started the diet before my surgery, and things have been going really well. I'm really happy with my choice to have the surgery done. So today I'm going to tell you kind of about the details of my surgery, what I'm eating now, my activity level, and what's going on with my fills. So let's get started. So my surgery, I had a 10cc band placed around my stomach. Currently has no fill in it at all. I had 5 incisions. They did the surgery laparoscopically, so just small ones. The largest one was probably 1.5 to 2 inches long. And I'm actually going to show you a picture of my incision right now. So that picture was taken about 2 weeks ago, and since then all of the steri strips that you saw on my incisions are gone, and I don't have to keep it covered anymore. But if I go to work into nursing and I'm going to be doing a lot of movement, I try and keep a dressing on it, and I'm also trying to keep the incisions moist so that they'll heal faster and I will have less scarring. So pain-wise after surgery, it wasn't like a stabbing pain like an incision site. It was more of like a dull, sore, aching pain, like it was heavy in my stomach. But they gave me in the hospital a scheduled dose of Toradol IV, which is a non-narcotic pain medicine, and a scheduled antiemetic to keep me from getting nauseous. The Toradol didn't really do much for me, but I also had morphine that I could have, and I did have a couple doses of that did help throughout the first night. Didn't have any of that shoulder pain that some people complain about, that I know can be pretty intense, but I didn't have any of that. When I got back to the room after surgery, I was up walking within the first 15 minutes of getting back to the room, and I took walks throughout the night and in the morning. It just kind of helped me, and I just didn't feel like I wanted to be sitting in that bed for the whole time. Couldn't eat anything until the morning, nothing at all, and then went down at the hospital for a barium swallow, where it was pretty awesome because I swallowed some IV contrast and actually got to see it going down through my esophagus, passing through the band, and I got to see where the port was placed, and I could actually see that the band was patent and things could move through it. So after they made sure that there was no blockage from the band, I could have fluids. And I was released from the hospital that morning around 10:30. So let's see, I was sent home with some medication for pain, liquid pain medicine, liquid Lortab. That helped a lot. He said that some of his patients, my surgeon, that some of his patients don't even refill their pain medicine, but I did, and I ended up needing it because sleeping was a little bit painful for me. It felt strange on my port site to lay down. So right now, 3 weeks out, no pain at all. The incisions don't hurt at all. They have healed completely. Well, not completely. I mean, there's still some redness there, but they're all, none of them are open. There's some discomfort at my port site. My port is on the right side of my midline stomach, and last week it was hurting more than this week. I probably should have taken that 3rd week off of work, just because my work is kind of physical, up and down, reaching, pulling, pushing, and it was just a little bit too much for me, standing and sitting all night long. So my port site was very painful. Ended up calling in sick one day, but it's feeling much better now. I am mostly don't even know that it's there unless I bend over in a strange way. Then it's a little bit of discomfort. I can tell that it's different, but otherwise I would never know that anything was different. So let's talk about my food timeline. Got back from surgery. I was on liquids for the first 5 days. 5 to 7 days I was on thicker foods and things that were pureed. So I could have pureed chicken, and I could, let's see, I made chicken parmesan and pureed it. And I'll actually, I'll show you a picture here of some of the things that I ate during that time period. And then after 7 days, I started to introduce regular food again. So let me go first and show you a picture of some of the foods that I was eating during my liquid phase and then the pureed phase.